Are you suffering from tension headaches or migraines, or maybe you're not even sure which is which? Some people even have both. So I'm Dr. Norris. I'm the owner and clinical director here at Koru Chiropractic Corrective Care in Louisville, Colorado. And my specific focus within corrective care is upper cervical chiropractic care. Okay, and I'm a NUCA certified practitioner, meaning I focus a lot of my work at the very top of the spine. I find that that's where most headache and migraine sufferers have their problems. Also causes other issues like vertigo, dizziness, and even numbness and tingling into the arms and hands. So let's talk a little bit about the two different conditions, and then I'll explain a little bit about how chiropractic can help. Tension headaches are the simpler, kind of easier ones to fix, quite honestly. A lot of times it comes from tension, as we say. You'll feel it like a hat band that wraps around the head, usually on both sides. And usually it's associated with like a stiff neck, tightness in the shoulders, poor posture. I find a lot of my tech workers who sit at a desk all day, they suffer from tension headaches, okay? And a lot of times they end up getting them kind of later in the afternoon because they've simply just been sitting for a long time. Slowly, their posture is kind of getting worse and worse throughout the day, and you do that for enough days on end, and eventually it's just stuck like that. Maybe you can start waking up with headaches. You know, it can get worse and worse, but fortunately, this is something, again, that can respond with chiropractic care, because oftentimes as those joints slide forward, they get a little bit stuck, or maybe you've even had a traumatic injury that causes the joints to get a little stuck and shifted out of place. And when we do really specific but gentle adjustments to the spine, we can get things moving better, we can get them freed up, we really actually can get the whole nervous system and therefore the whole body functioning better, and typically the headaches go away pretty quickly, sometimes in the first visit. Now, migraine sufferers are a little bit more complicated because migraines are multifactorial. There's a lot of different things that could potentially trigger a migraine. There's a lot of theories on what's actually causing a migraine. But what I know is by just only working on the spine, not making any major like nutritional changes or lifestyle modifications in terms of even avoiding triggers, I've seen a lot of my chronic migraine sufferers have complete resolution of their migraines, or at least get to a point where the frequency has gone down tremendously, intensity has gone down tremendously. And so the ones that they get are a lot milder, a lot less regular. And oftentimes it's a sign that they are slowly over time have shifted back out of alignment, and they just are due and in need of a good spinal correction or adjustment, okay? And so the thing with migraines is, again, what are all those causes? Well, maybe it's a kink or a catch in your neck here that can be irritating the nerves and, you know, causing some of that referred pain. Oftentimes migraines are on like one side right over the skull. They're going to be associated with sometimes blurred vision, other ocular disturbances, sometimes even nauseousness and vertigo or dizzy spells. Sometimes people even get like numbness and tingling at the exact same time. Now, when you have a big shift at the top of your spine here, right where these elastic bands are coming through the spine, that's actually a blood vessel when it's in your body, okay? And it goes up into the back of the skull here and supplies the back third of your brain. Well, your brain's not very happy if it's not getting oxygen and if it's not getting rid of waste products, okay? And so what we need to do is get the upper neck corrected into its optimal alignment. All of a sudden we see that blood flow is restored, migraines are happening less often, and people are usually feeling a lot less stress and tension in their shoulders, right? I've even helped people who have had menstrual migraines, you know, that come about usually when they're going through their period and menstruating. They'll notice like that week is the week that I always get the migraine. Now, could be triggered by hormones, and that's definitely something that can make our body feel a little more sensitive at certain times of the month. However, when we get their upper neck corrected, all of a sudden they're not having that same frequency of their migraines with every menstrual period. So I can't say that it doesn't have any effect or any connection to their hormones, but what we know, again, is by getting the spine realigned, getting the blood flow optimized, and getting nervous system function optimized, we've seen great results here at Koru Chiropractic with migraines, and NUCA has seen great results with migraines just through hundreds of different doctors across the country. In fact, one of the best papers on chiropractic care and migraines was done by NUCA doctors, and I have a link to that paper in my blog that this video is associated with. If you somehow got to the video without seeing the blog, I'm going to put the blog link in the video, and hopefully you can connect the dots between the two. And if you are in the area and you need quality chiropractic care and are looking for results and a long-term solution for your tension headaches and migraines, I would love to be your guide. All right, guys, Dr. Norris, hope you're having a great day. Talk to you soon.